Hello. This is Kevin Wood again at your service to go over and review the three tightly knit tri-benefit companies: Medicare, Social Security, and Medicaid. So today we're going to go over that, and you'll understand better about what these programs are and how they are separated out and what they do for the people. Medicare is regulated by Centers for Medicare and Medicaid Services. A person should call Social Security at 800-772-1213 to enroll into Medicare, or call the Department of Workforce Services to apply for Medicaid or Medi-Cal. There are three ways to apply: online, by phone, or walk-in. However, the best way to apply is always online. Here now you're going to get Medicare in a nutshell. It started in 1965 for people over 65. The first year enrollments were 19 million. It is our federal health insurance for people who are retired. Also helps people under 65 with a disability. And if they receive and collect Social Security income, disability income, then they will get Medicare after a 24-month wait after they get signed up on disability. The phone number to Medicare is 1-800-MEDICARE, and they're open 24/7. A lot of people don't know that. I remember the day that I found out that they were open 24/7. And that allows people, a lot better services. Original Medicare has two parts to it, A and B. Medicare 101 continued. There are two parts to Original Medicare. Part A comes automatically earned from working and paying into the system. That's the 40 quarters is 10 years. Part A covers hospitalization only with 3 pints of blood as well. And there are 3 benefit periods. 1 to 60 days has a deductible of $1,288 as of 2017, capped at 5 times annually. So it is actually a benefit that stops, and when it stops, it carries into the next benefit period. 61 to 90 days is the second benefit period, and their copay for the hospital is $322 per day, and that's where it can get kind of pricey. I always go through all this with any Medicare beneficiary and explain about what the worst case scenario is, because Medicare really isn't catastrophic coverage. So on this particular time, when they have 90 days times 322, that's almost $30,000. And so after that time period is expired, and it's consecutive days from 1 to 60 and going on from 61 to 90, then 91 to 150 day co-pays are $644. Now notice a pattern here, and every year when they do increase these co-pays and deductibles, it's actually a fraction. So if you take 322 per day and double it, it's 644. So that's how that makes it easier to learn the new numbers every year at the beginning of the year. Now after 151 days, coverage stops. It does not continue. That's basically the loss of catastrophic coverage. Nobody really has any with Medicare. So that's why they need a supplement. That's why they need a different kind of Medicare plan other than Original Medicare. Original Medicare is just antiquated. It's old-fashioned. Now, there is some coverage for skilled nursing recovery. Medicare pays 20 days at no cost. However, the problem with that is that it has to be for recovery and getting better from what you're in the hospital for. It might be a hip or joint replacement, or some sort of illness, and you're recovering. Now, if the doctor comes in with this clip chart one day and says, "Oh, you're not getting better," well, then that would be a time where they would consider putting you in a nursing home, long-term care, assisted living, and Medicare does not pay for that at all. So after the 20 days, there's 80 days at a cost of $162.50, and then totaling 100 days. So that's 20 days for no cost and 80 days at $162.50. Totals 100 days. Patient pays the first 3 pints of blood, and that's 2016 numbers. Now, Part B covers medical with a premium of $121 per month, and that's the Part B Medicare premium. This premium is deducted from beneficiaries' Social Security check automatically. Unless they are not receiving their Social Security benefits, then they would pay this on a quarterly basis, maybe a void check or something. They could do an electronic funds transfer or EFT. They can set that up with Social Security. After the annual $166 Part B deductible in 2017 number, that deductible, when after it's met, then everything's covered with Medicare, and Medicare pays 80% of the approved charges. There's something called the approved and customary charges, and those codes have to be properly put in the system, and then that would be what is paid 80% on. And it's really a formula of about 70% reduction from the original bill, and that's the 80% that the Medicare pays. Patient will pay the 20%, and 3 pints of blood are free, the first 3 pints of blood. Part D is for drugs. The prescription drug plan can be purchased in a PDP, which is a Part D plan standalone without any other medical, or it can be purchased within a Medicare Advantage plan with a Part D embedded in the plan. And so in that, the Part D always has a 5-tier. It actually went to a 6-tier in some counties. And these co-pays are paid in tiers 1 are generic drugs, tiers 2 are non-approved generic drugs, paying somewhere around $10 for the drug for a 30-day supply. And tier 1, the approved generic drugs, is about $3 to $5 per 30-day supply. Tiers 3 is the approved brand names, and they're running usually about $50 for 30-day supply. And tier 4 is the non-approved brand names, and that's running about $100 a month for 30-day supply. And tier 5 is what's called an injectionable drug, and that's for chemotherapies and drugs that are intravenously administered. So there is a deductible on these drug plans, typically $200 to $400. So if the person has a drug plan, they can also order through the mail order and get 90-day supplies, which is very helpful. And there's more on that when we talk about these other programs, Part D, and so forth. Part C is a major medical hospital plan with copays and deductibles. There, in many cases, is zero premium, but there can be a premium, and sometimes, often, it's up to $75 to $90. Depends on the company. And for each service upon use of these major medical plans, as I said, there are these copays and deductibles. A doctor visit might be $10, and a specialist visit might be $50. Emergency room would be something like $75. These plans are not Medicare supplements by nature at all. These plans began in 2005 when the Bush administration saw the baby boomers coming, and they were looking at Medicare and said, we can't handle the 60 million baby boomers. So they outsourced. They came up with this program of a Medicare Advantage plan, and they went to the private insurance companies and asked if they would manage the Medicare plan for Medicare. So Medicare is outsourcing the Medicare plans to their beneficiaries, and the beneficiaries have this choice. They can either have original Medicare with a Medicare supplement, A and B with a Medicare supplement, and a Part D standalone, or they can have Part C Medicare, which includes Part D, and it's a major medical hospital plan, like we just talked about. Okay, so Medicare Advantage plans are delivered a number of different ways. These plans are delivered to the beneficiary in the following ways. These Medicare Advantage plans with Part D included in it are delivered to the people through networks. Medicare supplement plans do not have networks. A person could go to any doctor anywhere in the nation if they're a Medicare doctor. On these plans, their networks are local and usually following the county borders. And the HMO is the Health Maintenance Organization. That's the most common plans that are available in the Medicare Advantage arena. The PPO, Preferred Provider Organizations, are somewhat accessible. It depends on the county. If it's a rural area with no services, that might be an opportunity for an insurance company to put together a PPO there because they don't have enough people to manage an HMO. Point of service sale is, and again, you can read the fine print. Take your time, pause, and read the fine print. POS coupled with an HMO works very well. It's almost like a PPO, basically. Now, a PFFS plan is private fee for service, and those are often found in the rural areas because that's not an HMO. They don't need the HMO networks, and it's not a network plan. However, you need to make sure your doctor will accept the plan before you jump into it. Private fee-for-service plans have some qualifications. The way Medicare is managed, the Medigap plans, also Medigap or Medicare supplement plans are PFFS plans as well as Medicare. So that's how Medicare is provided. So you go to any doctor that accepts the plan's terms and conditions of payment and no network. SNP plan, SNP, stands for Special Needs Plan. They're limited plans depending on the state. Plans for patients that have chronic care needs or Medicaid, Medi-Cal, for example, dual eligible, or for someone in a long-term care facility or battling a chronic illness. These have SEPs. You can change them at any time throughout the year. When you discover a person who has a dual eligible on Medicare, Medi-Cal, you can change them at any time throughout the year. We don't have a whole lot to do with the Medicare medical savings account plans. I have never seen them in all the counties that I've worked in, so I'm not really sure that they're even available, but they talk about them in the Medicare guidebook. The website I will show you here now is medicare.gov. Here is where a person could click on Find a Drug Plan or Apply for Medicare, another avenue to apply for Medicare. And so right here we would click on Find Health and Drug Plans. This is for the Medicare Advantage plans and Part D drug plans, standalone drug plans only. And to help you see that, I'm clicking on this and it's going to ask for a zip code. So in this I'm going to just pretty much put in 95361 and hit enter. Do you have any one of these original Medicare? I always just put in there, I don't know. And then click continue to plan results. They have the option to enter in this system the drugs they're taking, and it'll point them to the best plan possible for them having to do with their drugs. So here they would be able to type in a drug. Let's do metformin. That's a very common drug. So there it is, metformin, HCl, have a bunch of different choices. You hit find my drug, it's going to find the drug, and you would basically choose the drug here. Add the drug, and I would probably just do a generic one. And then they could add the drug to their list. They could do that over and over again as many times as they need to complete in entering all their drugs into the system. And you can see here where it actually shows up metformin, 500 milligrams, and that would be what you want to do. You'd have to choose a pharmacy as well. It says my drug list is complete. So I'll just click on that. It's going to take us to the different plans in this county that I chose, which is Stanislaus County. So here, step 3 of 4, it's not that many steps to go. You have to choose a pharmacy. I'm just going to say Oakdale Pharmacy. It's right down the corner. There's CVS, Rite Aid, Walgreens. Let's do Walgreens. And Walmart is too far away. I've chosen the actual pharmacy. Now continue to my results. That's just the pharmacy that I would say I'm using, which it actually is. And then we will go right into choosing a type of health plan that we're looking for in the Medicare Advantage plan arena. The prescription drug plans only, these are standalone, is 24 plans in this county of Stanislaus, a big county in California. And then the Medicare health plans, there's 13 of them, companies that offer Medicare Advantage plans with a Part D included. The drug plan is included. And then there's a plan that's a Medicare health plan without drug coverage. That would be for a person who already has some drug coverage through like government's Blue Cross Blue Shield plan, or if it's TRICARE or some retirement plans who have some health care coverage, but it's not a complete plan. So I'm going to check on the most common, and that's the health plan with drug coverage embedded. And then I'll go ahead and I'll click on Continue to Plan Results. And here on the plan results, it'll show you the actual plans that are available, including Original Medicare, which is the start of it all. And so here are the different plans that are available in this county. Original Medicare is, here's the zip code we're looking in, and the first plan that comes up, and it's always showing that compared to by the average cost of the plan, the estimated annual cost is right here at $2,000 a year. And then it has a retail price of the monthly premium of $4.40 a month, premium in addition to the Part B premium that they're already paying. And then one of my favorites, which I am selling a lot of, is alignment. Now this alignment has a $19 premium, but the one that we often sign people up with is the alignment all care with zero premium. So as we go down the list here, there's CareMore Start Smart Plus, CareMore Coordinated Choice, another alignment plan that's $36, and then there's AARP Secure Horizons Plan 2, which is zero premium, Humana Gold Plus, and then Plan 1. And that's all the plans they have. So you could actually choose 2 or 3 plans to compare and click Compare Plans and then put them side by side across 3 in a row. Okay, so that's how I use Medicare.gov. Medicare Supplement began in 1973 after Medicare started in 1965. There was a lot of plans or insurance companies that came out with their version of a Medicare supplement in the early stages that would supplement Medicare A and B, but each insurance company had different co-pays, different premiums. It was so confusing. Medicare put their foot down and they said, look, we're going to just standardize these plans. And there was plans A through J. And they were going to just take them. In the 1973, they came up with the Medicare supplement. It's designed by private insurance companies to pay where Medicare started to pay for the service, but left behind large balances, co-pays, deductibles for the retired person to pay the remaining 20%. And that's where the Medicare supplement pays that 20%, which creates the very best Rolls Royce in medical care, healthcare for retirees. Many companies jumped on the opportunity to sell Medigap policies or plans, and before long the plans they offered were all different one another. As I had mentioned, they varied so dramatically it confused the people on Medicare. Medicare took control, and these Medigap plans, they designed 10 standard ones, plans A through J. Now that's changed, and I'm getting to that, but I don't want to get ahead of myself. But the only difference was the insurance company that managed it and the premium the client paid for it. So I'm a big firm believer that I get the company that charges the best premium is the best thing for my client because they're standardized plans and nothing can be changed in them by the insurance companies. They have to follow the rules of Medicare to be able to, sell the Medicare Advantage plans. Since then, there has been an additional change. 2005 brought the privatization of Medicare, outsourcing, as we discussed on the previous slide, for the Medicare Advantage plans. And a new Part D Medicare, thus dropping plans EHIJ. And in 2007, they added KLMN Medigap plans. I'm going to show you a chart pretty soon. You can see how they all lay out. If you're confused, imagine your clients. Angst in 2005 also called on private companies to manage a major medical plan. The new Part C, referred to as Medicare Advantage, a managed care plan, HMO. Companies went to work marketing these plans, and since Medicare was subsidized, they were subsidizing paying the participating company $500 per month was their subsidy and or supplementary income for managing the Medicare Advantage plan. That money came in every month, plus the $121 Part B premium that the beneficiary pays also is forwarded to the private company managing their Medicare plan. And so for every person enrolled in the companies that have these plans, insurance companies wanted the masses to enroll in Part C and collect per person premiums. Of course, that has been their goal. They're marketing very heavily every annual enrollment come October 15th through December 7th. It's heavily marketed. Now, Medicare supplement plans, you can see here the different plans available. A is a very basic plan. It doesn't have all the boxes checked off. B, it introduces one more, and that's the Medicare Part A deductible. That's the $1,288 we saw on the first slide. And then it gets into C, which doesn't have the Part B excess charges. And D is just, it's just variations of the same stuff. But the best plan, the most common for people to choose is F, because it's 100% coverage. All the boxes are covered at 100%. G, however, is very much like F, but the Medicare Part B deductible is not paid. However, the premium is a little bit lower, so they have the decision making on that. And then K is 50%, L is 75%, and M is 100%. And N 100% in some cases. So that's the basics on your Medicare supplement plans and how they came about. So there are qualifications to enroll in Medicare supplement. A person must have Medicare Part A and B and afford the monthly premium, so they're not on Medi-Cal, Medicaid, and pay a separate Part D premium for a standalone PDP, and then also they must health qualify outside of any open enrollment period. So in other words, if it's not their open enrollment, which there's no health qualifying, actually it's automatic or guaranteed issue. If it is outside of that open enrollment period, which is 3 months before their birthday, 3 months after their birthday, and then it would be answering the health questions. But you can enroll somebody into Medicare supplement anytime throughout the whole year, change them out of the plan they have. If your plan is going to be a better plan, like going from a C to an F plan, and then the F plan also has what's called a select plan. Select F plan would limit hospitals that they could go to. So it actually has limitations to the choice of hospitals. However, and that would be for scheduled surgeries. However, on emergencies, any hospital, they get coverage. Medicare Advantage plans, their qualifications are live in the service provider area. That would be their network. Have Part A and B Medicare eligibility, and then not have end-stage renal disease. So Advantage plans are designed to cover all what Medicare covers and more. The added benefits are often a PDP included or embedded, annual wellness exam, vision, hearing, free gym membership through silver sneakers, and much more. And so that's how the Medicare Advantage plans are different from Medicare supplement plans. And so next, I always read this page with clients. It really helps for them to understand how a Medicare Advantage plan is different. Most of the people have had experience working with their parents on a Medicare supplement. So they see that as a way to get their benefits, but in reality, they're basically getting new benefits available to them they don't know about. That's the Medicare Advantage since 2005. So that's not the Medicare that it used to be for their parents anymore. Well, what are Medicare Advantage plans, or Part C? So this is a page copy right out of the Medicare guidebook. Now it's not page 72, I think it's now 83. They change the page all the time, but the title always remains the same. What are Medicare Advantage plans, Part C? So I read right through this page, and I'll read it with you right now. A Medicare Advantage plan, like an HMO or PPO, is another way to get your Medicare coverage. If you join a Medicare Advantage plan, you will still have Medicare, but you'll get your Medicare Part A hospital insurance and Medicare Part B medical insurance coverage from the Medicare Advantage plan, not original Medicare. So Medicare Advantage plans are a replacement to original Medicare A and B by giving a person Medicare C and D. Medicare Advantage plans, sometimes called Part C and MA plans, are offered by private companies approved by Medicare. Medicare Advantage plans cover all Medicare services. In all types of Medicare Advantage plans, you're always covered for emergencies and urgent care. Medicare Advantage plans must cover all of the services the original Medicare covers, except hospice care and some care in qualifying clinical research studies. Original Medicare covers hospice care and some costs for clinical research studies, even if you're in a Medicare Advantage plan. Now I'm jumping down to the next title. Medicare Advantage plans must follow Medicare's rules, so they're bound to follow those rules. And then there's another page which says typically Medicare Advantage plans receive funds from the Medicare when they participate. They're paid by Medicare to be working in the Medicare Advantage arena. So you can download this book, Medicare and You, 2017 or whatever year it is, at medicare.gov, or just Google it, Medicare and You 2017, and the book will come up as a PDF, and you can download it at that time. This is very important to do as an agent working with the senior market. They need to see that you know how to navigate it and how to get around the Medicare maze, because that's how you build trust. They'll get this book in the mail to them about a month before they're on Medicare. The change was good in 2005. The differences are important to understand and see the comparison below. So as I said earlier, the Bush administration decided that the 80 million baby boomers going on to Medicare the next 15 years, they thought it would be better to outsource beneficiaries their federal Medicare health benefits to private insurance carriers that would follow the CMS regulations and guidelines. And it has been 8 years, no, it has been 11 years now that since that change, and there are now approximately 60% people enrolled in these Medicare Advantage plans, and alternatives called Part C Medicare. So you can see here how it's separated out. Another way of looking at it. Medicare Step 1 in the middle. How does Medicare work? Has Part A, covers hospitals. Part B covers doctor and outpatient visits. On the left side is original Medicare with Part A and B and a Medicare supplement. Cost on a Medicare supplement over $100, and then it goes up every year based upon age and increasing age. Medicare Part D is a separate plan, somewhere around $29 to $35, even up as high as $100 a month. There's 3 different types of Medicare Part D plans. Typically, there would be a value plan, and then there would be a middle of the road plan, and then an enhanced plan. So it'd be value plan, preferred plan, or enhanced plan. Medicare Advantage Part C, however, is option 2. It combines parts A and B, and it makes it Part C. So A and B is not working for them, only Part C. Additional benefits as well, like dental, vision, hearing, and the annual wellness exam, which original Medicare does not offer an annual wellness exam except the first year they go on Medicare one time. And then most plans coverage on prescription drugs. These are offered by private companies. Here's a great tool to use. I recommend if your potential client is taking 4+ prescriptions, then run them through the Medicare.gov. That's what I showed you earlier. The drug search tool, doing this will direct you to the plan that offers them the lowest out-of-pocket cost for that person. Specifically with their drug load, it's not drop dead critical, but helpful if you have time to research it. Also, use this website to search the MAPD plans available by zip codes in their area. This is also critical because some counties don't have any MAPD at all there. Do the best job possible for your clients. Do your research. For example, I had clients out in Murphy's, California, and they're so far out in the rural area, they don't even have a Medicare Advantage plan there, and all I could give them is a Medicare supplement. Medicare supplements typically are available all over the nation, in every county, every zip code, but you should check that as well. We will be happy to provide you, upon request, a web-based quoting tool login to compare Medicare supplement plans by zip codes, and this way you can see the competition out there as well, how they're priced. Keep in mind these tools are for agent-only use, not to show to any Medicare beneficiaries. It's not a selling tool. Medicare is very particular about regulation and to regulate sales, and marketing materials. These are not approved online quoting tools. You must always get your marketing materials approved or use their generic versions. Part D Medicare is for drugs. As we have discussed, the average premium Part D is about $35 per month. There is a penalty of 1% per month if they are not enrolled when they're eligible on a Part D plan. 1% per month. And I have met people who are paying 16 to 25% on top of their average Part D plan in their county. Say it's $35, that means 16% on top of that. I'm sorry, $16 on top of that. Upon finally taking the Part D plan, the penalty is added to their monthly premium, $15 per month or 15%. Sometimes there is also a deductible on low-cost plans. Higher cost plans waive that deductible because they're getting a higher premium. So they either take the money up front on the premium side, or they get it on a deductible side. It just depends on the plan, and a person could choose that. There is a gap in coverage called the donut hole. That's a shared cost up to $2,250 at this webcast. And the donut hole exit is $4,550, and this changes every year. After the donut hole, they pay only a 5% catastrophic coverage for off the retail price, copay for catastrophic coverage. However, that donut hole is disappearing. Drug costs inside the donut hole was 100%. This will decrease every year till 0% by 2020. Right now, it's 40% of the 100%, as it was when it started in 2005. Part D has 5 copays and tiers. As I went over before, I'll go over it again. There's about 60,000 national pharmacies in the Part D network across the nation. And Tier 1, as before, is for preferred generic drugs. Most plans have a mail order option available. And oftentimes they'll be at discounts, maybe getting the third copay eliminated. So you only pay for 2 copays for 3 months. Tier 2 is non-preferred generics. The formulary can vary from company to company. The formulary is the list of drugs they have. And each insurance company is required to have at least 4 minimum drugs for each ailment or illness. So there's always going to be drugs in each formulary for every illness. It may not be the drug they have, but they can switch over to one of the 4 drugs that's available. Tier 3 is for approved brand name medications, and Tier 4 for non-approved brand name medications. Tier 3 is about $50 a month, and Tier 4 is about $100 a month. Tier 5 is injectable drugs, things like intravenous or chemotherapy. If a patient's drug is not in the formulary, then the doctor can write a letter of exception to help to add Number 13, if a patient's drug in again man Number 13, if a patient's drug is not in the formulary, then the doctor can write a letter of exception to have it added to the formulary. Number 13, if a patient's drug is not in the formulary, then the doctor can write a letter of exception to have it added to said formulary. Number 14, or they can try another drug. This is called a stair-step trial, step up. This is called, say again, this is called step therapy. That way the plan will provide the drug that they need. More on Medicare Part D plans, drug benefits. This is Coventry Aetna bought Coventry. And so this is not too old, 2016, this is now 2017. But this shows you the different levels of the coverage for the Medicare Part D. The deductible phase 4 is, the catastrophic. So starting down at the bottom, phase 1 is the deductible. This one's $360. Others can be $200. I've seen them as high as $400 per year deductible. And phase 2 is the initial coverage period, and the retiree pays 25% of RX costs. Phase 3 is the third level, and then you have phase 4. So I won't go through the members. Well, you can read this part. Members pay up to $360 annual deductible. Members pay co-pays, co-insurance during the initial coverage period until annual total drug costs reach $3,310, and it just goes through about the true out-of-pocket expenditures, total out-of-pocket costs. So that's more on Part D. What is not covered by Medicare? This is pretty straightforward. I usually say Medicare will only pay for procedures that are medically necessary. I have listed some examples here, and believe you me, you want to talk about these areas with passion because there are huge opportunities to sell more policies and plug these holes in the asset protection plan for your client. Long-term care is not covered, only things covered like recovery care. Long-term care, assisted care, someone who's not going to recover is not covered by Medicare. It could get bad, and hospice care would be covered. Dental, vision, and hearing is not covered, not medically needed in Medicare's eyes. So we have standalone dental, vision, and hearing plans that are either discount related or they are full-blown insurance. Cancer treatments that are non-approved or experimental, and travel or board for out-of-area care, like if someone goes to Mexico or another state, if you're on a Medicare Advantage plan, or a Mexico health farm, that's not covered. That's why a cancer plan is so valuable. I have one myself. Not covered is acupuncture treatments. Part D won't cover vitamins or Viagra, etc., or over-the-counter drugs. It won't cover cosmetic surgery. In 2014, deep cuts were made for home health care. That took away some of the benefits in that area. Advice: when you're in a home and you have the sale, but they don't have their Medicare card yet, you need to see it to complete their application. Just call Medicare. They're open 24/7, confirm by phone their card information. Bam! You put in the application and get paid faster, rather than having to wait for them to wait for Medicare to deliver that card to the mailbox. Enrollment into Medicare. These are the enrollment periods. The open enrollment period, OEP, is the time when a new person to Medicare can enroll into their Medicare and any type of Medicare core health plan that they want with no health questions or guaranteed issue status. The OEP window is 3 months before their birthday and 3 months after their birthday. Or if they are continuing to work, it can be postponed if they have credible coverage until later, and they can enroll in their Part B after they stop working and their health care coverage stops. This will create another OEP 3 months before and 3 months after the month they start Part B, adding this to their Part A. Part A comes automatically because people pay for it in the past as they're working. There's no cost to Part A. General enrollment. If a person did not sign up for Part B, but they were eligible for Part B and they were not working and did not have a health plan in their possession for which they were paying premiums, then they received only Part A and they didn't get Part B, and it was the first time they were eligible. They can sign up between January 1st and March 31st each year for Part B Medicare. That is the open and the general enrollment for Medicare Part B if they missed the enrolling when they turned 65. I've ran into situations like that where they have, and I just get them on the phone, get them enrolled in Medicare Part B, but it has to be from January to March, and the effective date will be July 1st. Okay? Coverage will be again July 1st of that same year. Then they may have to pay a higher Part B premium for late enrollment penalty of 10% annually. So there are two possible OEPs. More enrollment periods are as follows. AEP is the annual enrollment period that happens every year for a person already on Medicare that they can opt in or opt out of Medicare Part C. They can go back to Medicare Part A and B during this annual enrollment period. It's through December 7th, Pearl Harbor Day. People already on Medicare can change plans for the new upcoming year and get a different plan if they want, or stay where they are and it renews automatically. The SEP is a special enrollment period when a circumstance arises like it's life-changing at no fault of their own. This creates a time to adjust their Medicare health coverage. There is a 63-day window to enroll them. Such events as move from their plan's service provider area. That's only for MAPD, not for Medicare Supplement. But if they move to a different county, it doesn't have to be a different state, although it would for sure be if they move to a different state. But even into another county in the same state could cause SEP for someone having to change their Medicare Advantage plan. Or Part D. If they lose credible coverage of any type through their group or individual health care plan, maybe the group or the individual care plan changes on them and or they lose credible coverage through a work plan, that would qualify for an SEP as well. Same window applies. Qualify for loss of Medicaid benefits or SNP plan enrollment month to month. So you can enroll a person into a Medicare Advantage plan if they're dual eligible on Medicaid and Medicare. They can be enrolled anytime throughout the year, month-to-month basis. That's good to know because that's an opportunity for you to help them and to improve their coverage and get paid. So there's nothing like running into somebody who is a Medicare, Medicaid dual eligible, help them get a new plan that's going to give them more benefits, and then you're getting paid, your commission. Critical illness or specialized care needed admitted to nursing home. So if a person has critical illness and or specialized care needed at a nursing home, that also is a special enrollment period. If they're admitted in the nursing home, that creates a SEP. And a person has 8 months to sign up for Part B without a penalty if they stop working and are on a retirement health plan. This period will run whether or not you choose COBRA. Otherwise, you have the general enrollment period previously mentioned, January to March, to enroll in Part B. But I have seen it. In fact, one of my agents, who was about 70 years old, he quit his work and he didn't carry over his health insurance. And it went more than 8 months because they were on Medicare. He had Medicare Part A, and he didn't sign up for Part B. He just got too busy or didn't know. But 8 months had passed, and he had to wait to enroll in Part B in the general enrollment period first of the next year. And that was a big shock to him. It says right in the guidebook. Who pays first? Medicare or my group plan? Sidebar, Medicare has an array of preventative services. Here they are listed. There's more than this, but this is just to give you an idea. The very bottom says, welcome to Medicare Preventative Visit. That's only once your first year. And then every year after that on original Medicare, there is no annual wellness exam. There's bone mass measurements, breast cancer screening, cardiovascular disease screening, lots of screening, chemotherapy, chiropractic services, even some acupuncture that I've heard recently. At any rate, these are lots of flu shots. They added recently shingle shots as well. Diabetes, self-management training, all free. None of this costs any money. How does my other insurance work with Medicare when you have other insurance like employer or group coverage? There are rules that decide whether Medicare or your other insurance pays first. Use the chart to see who pays first. You can go through that, pause it, and read through it and figure it out. In some cases, your employer may not join with other employers or unions to form a multiple employer plan. If this happens, the size of take that all off. Social Security benefits are often a moving target for people. When should they take their Social Security benefits? At 65, at 62. If you took it at 62, you'd be sure you got some benefits. But what happens if you were waiting to 65 and, like my dad, at 65 he passed away at 65. He never got a dime of Social Security. He should have started taking it at 62. So this is something you can really talk to people about. When should they take their Social Security? A lot of financial planners say, oh, you got to wait because you'll get more money later. Well, like my dad, dying at 65, not taking it at 62 because he was working right up until the day he died, planning for retirement, having the motorhome parked in the driveway, he never collected a dime. So you have to have this conversation. Maybe you tell him, hey, look, if you collect at 62, you know you're going to get your benefits. That's 3 years of benefits. And 65, you go on to Medicare, you keep your benefits. If you wait, you may never get them. Who knows? Sign up for benefits online, and that's what we've already covered, is the preferred method via phone interview. Go to a local office, take a number, and wait. People can sign up for Social Security at 62 or younger through a deceased parent or health disability based on unable to work. If they are already taking Social Security, then at age 65, so let's say they started taking Social Security at 62 and they retired, then they're already in the system. That means they don't have to go and enroll in Medicare Part B on socialsecurity.gov. They can just wait and the card will be automatically mailed to them when they turn 65, a couple months before their 65th birthday month. But that's because they're already taking their Social Security benefits in the system, and they started that at 62. So then at 65, they would enroll in Medicare A and B automatically because they are already in the system receiving benefits. A beneficiary can wait to take Social Security while they are working, then they can start at any time after that. A divorced woman who remarries loses her future benefits. Then if she divorces again, she will receive Social Security off her first husband's benefits. Disabled people can apply for Social Security benefits at any age if they're disabled. Proof of disability is required. Help from an attorney is recommended. And Social Security phone number is 800-772-1213 and their website. It's always encouraged that your potential clients should create an account. And in addition to that, they should enroll into their Medicare benefits through the Social Security website right here. And let's see if I can get into it pretty quickly. And so we go here to the menu, And right here is the Medicare. Clicking on that. So as you continue to scroll down, you'll see here applying for Medicare only. And here's the button, the big blue button, apply for Medicare only here. So we'll click on that. And this is going to take them into an online application process. And this is really all that one needs to do. So here it says apply for benefits or Social Security. Getting ready, you can read more about that. And then apply and complete, start a new application. And that's where we click on that. It says, make sure you meet the requirements for Medicare. And then this just starts out with these questions, and you hit next. And it goes through page by page. Okay, so that's how a person would sign up onto their Medicare benefits through the Social Security .gov website, ssa.gov. What are my Medicare coverage choices? Again, it's about the Medicare supplement with the original Medicare, and then the other option, Medicare Advantage. I just want to drill this into your mind. And you see here many different ways of showing this. This page right out of the Medicare and You guidebook. And this is what your potential clients see. Does this look confusing to you? It is our job to make sense of this page, to enroll them into the plan that best suits their lifestyle and health condition needs. Be sure and verify their doctors in the network. If you're doing the Medicare Advantage plan on Medicare, that wouldn't apply. They just have to be a Medicare approved doctor that they see. You may see similarities compared to slide number 8 in this presentation. I'm sure of it. Medicaid is run by the state. They are subsidized by the government federally, but it's run by the state. Medicaid, or Medi-Cal, is the largest source of funding for medical and health-related services for people with low income in the United States. It is a U.S. government program financed by federal, state, and local funds from hospitals and medical insurance, designed for persons of all ages within certain income limits. And Medicaid changes their threshold of income for qualifying every year. So this is just an example. A single person on Medicare might be eligible for Medicaid or Medi-Cal if they're earning less than $1,580 a month. However, a disclaimer, I've learned in some states, most states, that a single person on Medicare would not even be qualified for Medicaid if they're male and or a single woman. Only people that are qualified on Medicaid here nowadays is the ones that are single mothers with a child. They will qualify those people on Medicaid. So these limits I also can mention that are for low income subsidies, that's LIS. And so on these subsidies, these limits might apply because they're a little higher than the Medicaid. So single on Medicare with this income, they could qualify for low income subsidies, which is discounts on their prescription drugs. Medicare changes every year, that's a fact. Sometime late in the year, you can go to Medicare.gov and look up the new copays and deductibles. You could search it out on Google, you can find it easily, of the new Medicare A and B copays and deductibles. What usually increases are those copays, benefit days, and skilled nursing facility copays also increase. The Part A and Part B deductibles increase for hospitalization, and the Part B for Medicare premium, that is the premium they take out of their Social Security check automatically if they're receiving Social Security. If they're not receiving Social Security, they would be billed quarterly by Medicare for that Part B premium if they're not receiving Social Security yet and still working. If your client has a Medicare supplement, then no matter what these out-of-pocket costs are, the supplement will pay them. And these are called gaps, so that's why they have renamed Medicare supplement to be a Medigap policy. The only thing they will see is a 4 to 10% increase in their Medigap policy premiums, and that's every year. That's pretty low increase on health insurance in my experience. And that also depends on which company they choose as a client. A stable company like Mutual of Omaha or AARP or Oxford, those companies have low annual premium increases. I've even seen Mutual of Omaha lower theirs once before. If your client is in a Medicare Advantage plan, then they will see increases in the copays and deductibles, and even an increase in introduction of a premium. I feel like the days of zero premium MAPD plans is a thing of the past, and you need to understand free is in this program is based on claims filed throughout the year. So expect surprises from year to year. Okay, now I want to bring in a drawing tool that I want to show you how Medicare has regulated Medicare supplements. I remember learning this a long time ago, so I'm going to just share it with you. And all it boils down to is that with a Medicare supplement, they're regulated on what they can make in terms of profits. So what happens is that when these Medicare supplements are paying the claims, for every $1 that's paid into the Medicare supplement in form of a premium, every single insurance company that manages Medicare supplement have to follow these guidelines set by Medicare. And so every $1 premium paid in, then the insurance company is bound by regulations to pay out 60% of that dollar in claims. That's why one time Mutual of Omaha actually lowered their premiums because they only paid out 57% of the premium, and so they reduced, based upon claims paid, they reduced their premium that year. It went right back up the following year, but it wasn't a big increase. So in terms of what Medicare supplement plans receive as a per dollar in premium, 60% paid out in claims, that obviously means that 40% of that is going to be left over for the insurance company to pay their bills. What are their bills? Well, the bills are us, paying commissions. The bills are advertising. The bills are rents on their buildings. Everything outside claims, and they only have 40% to pay everything and then make a profit or keep some of the money. Hopefully they're keeping at least 10%, because any company, traditional company or big business would want to keep minimum 10% bottom line profit. But that is what it is. It is the truth on all Medicare supplement companies. They have to follow these regulations or guidelines. Okay. Now, just about be sure and check out Medicare.gov for many additional resources. And here's a YouTube video here that I will click on. A quick little history lesson on Medicare.
1960, the nation's governors approved a resolution urging the Congress to pass health insurance legislation. And in 1961, the first White House Conference on Aging, appointed by President Eisenhower, recommended health insurance for the elderly. But despite all the support, the Medicare bill was defeated by a close vote in the Senate in 1962. In 1965, President Lyndon Johnson made it a top priority. He had this to say:
"Our older people are likely to be hospitalized 3 times as often as younger people, but their income is less than half that of people under 65. The end result is what? They then turn to public welfare. Now, this is not the American way. The Social Security Health Insurance Plan, which President Kennedy worked so hard to enact, is the American way. It is practical. It is sensible. It is fair. It is just.
Go to YouTube yourself and find many different videos on historical facts about Medicare. So for now, we're wrapping this up and ready to close it out. Here's some additional resources, some video links for your understanding. You can take a snapshot of that and run those into Google search or to YouTube. We thank you for your business. We appreciate you. Here's to your success. Knowledge is power, and I'm a firm believer in keeping up on changes in knowledge. And it is your responsibility to know this stuff as you go out there. And I take responsibility on keeping you up to date and teaching you that. I had a situation where I wrote a Medicare supplement on a application that I hadn't used that company for a while. And it came out that application came back to me because the application was outdated, and that made me upset. But it was my own fault, because if you're gonna be writing Medicare supplements, you need to check with the carriers that you're appointed with and make sure that you have updated information or updated the paperwork and applications, brochures, and all that. Your responsibility to keep current. How many parts does Medicare have? 4. What year did Part D and Medicare Advantage Part D start? Do you remember? Answer is 2005. What does OEP stand for? And it stands for Open Enrollment Period. What government agency regulates Medicare? CMS. Centers for Medicare and Medicaid. What are the only 3 qualifications a Medicare beneficiary must have to enroll into a Medicare Advantage plan? A Medicare Complete plan. Do you know? 3 qualifications is all they require. And that is live in the service provider area, have Part A and B Medicare, and not have end-stage renal disease. And write them up. If someone does not take Part B when eligible and has no group or credible coverage in place, what percent would their penalty be when they eventually enroll in Part B 3 years later? Answer is 30%. That's 10% each year they don't have Medicare Part B. That gets a little pricey. What is the monthly Part D penalty for one who is eligible to enroll in Medicare but takes no drugs and wants to wait 24 months before signing up with Part D? They have no other drug coverage going for them. And the answer is 24%. 1% each month on Part D for drugs. Thanks for your attendance and future business. And this is created by me, Kevin Wood. My phone number, Grandpa's Insurance Solutions. We'll talk to you later. Signing off.